If you have been experiencing symptoms such as increased thirst and hunger, frequent urination, and unexplained weight loss, then maybe it's time to see your doctor for some diabetes tests. Approximately 8% of the population has diabetes, be it type 1, type 2, or gestational, and early detection is the key to decreasing complications of diabetes, as well as the key to proper treatment. If your doctor suspects that you might have type 2 diabetes, he or she will do tests to confirm the diagnoses. A description of those tests follow. Fasting blood glucose test. Also known as a fasting plasma glucose test. In this diabetes test, the level of glucose, sugar, in your blood will be measured after you have fasted for 8 hours. A normal fasting blood glucose level is 70 to 100 milligrams per deciliter. A level of 126 milligrams per dl or more indicates type 2 diabetes. If your fasting blood glucose level is above 126 milligrams per dl, then your doctor will perform a second test for additional confirmation before diagnosing type 2 diabetes. Casual plasma glucose test. This test is similar to the one talked about above, with the only difference being that fasting is not required. It can be taken without regard to when your last meal was eaten, and measures the level of blood glucose in your body. A glucose level higher than 200 milligrams per dl would indicate type 2 diabetes, and again would be repeated by your doctor for additional verification. Oral glucose tolerance test. When fasting blood glucose levels are normal, and yet your doctor still suspects type 2 or gestational diabetes, this test is used. In this test, the patient fasts for at least 8 hours, and then the fasting blood glucose level is tested. Following this, the patient is given between 75 milligrams and 100 milligrams of glucose in a sweet-tasting drink. The blood glucose level is then taken at intervals over the next 3 hours. If the person does not have diabetes, their blood glucose rises quickly and then falls. If the person does have diabetes, their blood glucose rises higher than normal and then doesn't fall as quickly as it should. These 3 tests are the ones typically used to diagnose type 2 diabetes. Other tests are used to monitor diabetes once it is diagnosed, including hypoglycemia tests. Learn more at diabetes-tests.net.